Yeah. Hello, everyone. Today, I would like to present our work, which is towards testing of animals for LSDV. And also towards the end of the presentation, I would be telling you that we can go on to other diseases as well. So can I have the next slide, please? So as a problem definition, I think others have spoken before me. I won't take too much time, but India has a very large cattle population. And as per the registered number of animals with DAHD, there are close to 200 million animals. And this has enabled India to be one of the world leaders in terms of milk production and, not only for sufficing the requirements of India, but also there is a large export market as well. And this dairy industry is a very significant contributor to agri-economy ecosystem. And but one of the interesting things about India is that there is a large fraction of the dairy industry which is all unorganized sector. And so under this unorganized sector, the main problem is this infectious diseases affect animal welfare and the economy of the unorganized sector. And there is also a lot of One Health focus on the dairy sector because of increasing possibility of transmission to humans as well, some of the diseases. So today I would like to talk specifically about this lumpy skin disease virus. And as you can see on the right side, this disease is very new to India. It was traditionally, for many decades, it was reported only from the African continent. Towards the beginning of this century, it started to spread to Central Asian countries, and then slowly now it has spread to most of the Asian countries. And in India, it was officially reported from Orissa in 2019. And then rapidly it has spread across the country. And in the past couple of years, it has really created a huge disease burden in India. Next slide, please. So the economic losses to this disease have been somewhat calculated in different government documents, and it is pegged at around $2 billion USD so far. This is a cumulative loss, not annual loss. But if you look at the major reason for the loss is loss in milk production, productivity loss. And infected animals have been found to show up to 80% reduction in milk production within 2 weeks of having been infected by the virus. And interestingly, even recovered animals do not actually come back to their normal or original milk production levels. And this has been a major problem. It's not that the disease will come, we can cure it. Actually, prevention is much better in this case than curing the disease, because it doesn't solve the problem. Up to 3 liters of milk loss can happen in an animal. And further, even reproductive health of the animal can be infected depending on the severity of the disease. So even if the animal recovers, then there is further loss of productivity because of inability of the animal to conceive and reproduce. So if you look at the deaths, I think some statistics have been published. So what you're seeing here is just state-wise statistics. So a large number of animals are susceptible, and I'll show more data in the next slide. In case of adults, it is 1 to 5% of death is reported. And in case of heifers, so the young animals with below 2 years of age, up to 50% mortality is also reported, although the average mortality ranges between 2 to 10%. You can see here again more statistics where there are thousands of animals which are affected by the disease, and a few thousand of them. I think it differs in different states, but then a large number of animals were actually found to die because of the disease in the western states like Rajasthan and Gujarat. Next, please. So how do you tackle this disease? Clearly, it's a big problem. And pharmaceutical treatments, there is no specific disease-specific treatment. Generalized treatments are, available in, just to control the symptoms and other mechanisms. Mostly people use ethno treatments or local phyto treatments. Even ICAR website actually gives a list of such phyto treatments, which seem to work in some cases. And this disease is transmitted by flies, yeah, and as well as mosquitoes and probably ticks as well. So multiple vectors are known. So it's very difficult to control transmission, but still avoiding vector presence is also one strategy for control. Preventive vaccination is available in other countries. In India, so far, the government has not decided to use homologous vaccine. The available heterologous vaccine is the goatpox vaccine, which is not fully protective in the sense the efficacy is low, as well as repeat infections happen despite vaccination. And although death can be prevented, but disease symptoms and the after effects of the disease are all still a problem with vaccination, with the heterologous vaccination. So what can herd owners do, especially small holding farmers which have few animals? So of course, vaccinating animal is one of the first things they have to do, and symptomatic treatments can be done. But one of the things that is also really missing in the whole picture is early detection and also frequent detection. So local veterinarians who are under whom the animals are registered can actually recommend the testing to farmers, and the lab can conduct the test. And if we can catch the disease very early or even in the asymptomatic animals, separating the infected animals is one way of avoiding herd-wide spread of the disease. Next, please. So currently, if you look at the solutions, government recommends symptomatic testing. So once the disease is already flared up and visual symptoms come, then there is a lot of tests available for confirming that the virus is indeed LSDV and not any other disease. And so there are some ELISAs which have been developed, and mostly in ICAR labs and DAHD affiliated labs, PCR tests are also done. But as to the best of our knowledge, there is no, as of today, commercial testing available in India. So some kits have been developed in India with the Nivedi partnership with some industries. Like there is an ELISA kit, but of course ELISA comes after exposure. So preventive testing is not possible with ELISA. There are some imported options, which availability is again a problem in India, but cost is also high. And the kit which we have come up with, the methodology is a very straightforward PCR-based methodology. And we are trying to give it for very low cost. And this is a comparison of different aspects of the tests across the available products. So the most important thing is that asymptomatic detection is very critical to catch the disease early and put in the preventive measures. Next, please. So this is our value proposition. So we propose that we can have a kit, which is a kit which will include sample collection, which will be nasal swabs, and we'll include the swabs in the kit. And once the swabs come, they will be put into a solution, which is a DNA extraction solution. It's a one-step. And the solution can directly be added to a PCR mixture, which will then go for detection. It's very highly sensitive, easy to use, and it can be scaled up, quite easily. Next. So this is the number on the value segments. So basically, this is like there's a global market for veterinary diagnostics. And in our case, we are thinking that the customer segments can be veterinarians and farmers. And we are thinking that in future, we will go for multiple disease detection in a simple test. Also, we can do variations of pathogens like genetic variation. Next, please. So this is our technology. It is a PCR-based technology. We have nested PCRs arrayed across the genome. And here I'm showing some examples of some of the locations where we do the PCRs on the genome. And because of the nested nature of the PCR, it is very highly sensitive. Up to 0.1 femtogram DNA we can detect, which roughly goes to 30 copies of virus. And right now the readout is visual, which is electrophoresis, but we are planning to into a real-time assay. Next, please. So we have undertaken some preliminary studies in different states of India with some samples. The bottom line in this slide, which I want to talk about, is that asymptomatic samples can be detected at quite a high percentage. Next, please. So current status is we have done an invention disclosure of the technology, and we are also in the process of publishing, and we are presenting this work at different forums where it has been recognized with some awards. Next, please. And this is the team from NCL, and I'm the lead scientist of the project, and I have my lab people who are also part of this project. With all of them have expertise in infectious disease, particularly in animals, and some field experience. And our lab has been very productive in procuring funding and furthering work on infectious disease on animals. And next, please. So this is what are the next steps here. We, like I said in the beginning, we would like to take this as a similar protocol with the same sample collection. We would like to test other diseases, especially like foot and mouth and brucellosis. And why we seek industry partnership is to, first one is like scale up the technology and advance the technology for testing. And we can also look at technology licensing to industries who are interested in taking this up. And we can give consulting services for technology to develop assays in this disease. And we can even have data sharing, because we are also sequencing the pathogens as what we collect. So we can help other industries develop assays for these diseases or other diseases based on sequencing services which we give. Next, please. Yeah, we'd like to stop here, and thank you for your attention.